Hello everyone, good evening. Today we have with us Dr. Pragadheesh, who secured All India rank 61 in the recently conducted INICET November 2024, who has done his MBBS from Madurai Medical College and is a ADRPLEXUS regular batch student of Coimbatore 2024 batch. Pragadheesh, hearty congratulations to you, your parents, all the family members.
Yes, sir. Thank you, sir.
Pragadheesh, once the results are out, what is your first reaction?
I was very happy, sir. I was very happy with the result.
Okay. There might be many factors which might have contributed for your success. But if I ask you to pick up three most important factors, which one you pick up?
Sir, I would very much like to thank my senior who suggested ADRPLEXUS for me. He was my guidance from second year itself. He was the one who helped me a lot in being competitive and gave a good exposure on PG preparation and quizzes during UG times also. He was he was he got his rank in last INICT November INICT. He's currently he's also an ADRPLEXUS student.
What's his name?
Narayanamurthy Ganesh, sir.
Oh, Narayanamurthy went fantastic. Like that's how the legacy should pass on, like from the seniors to the juniors. Fantastic. And Narayan, like it's hearty congratulations to you too for all the support which you have rendered to your junior, and the fruits are here.
Yes, sir.
Please go ahead, Pragadheesh.
I would like to thank him very much, sir. Without him, none of this would have been possible, sir.
Okay, this is the first is your senior Narayan who helped you, to mentor you and suggested you to go to the ADRPLEXUS and also handholded you and achieving this journey.
Yes, sir. Throughout my UG from second year onwards.
Fantastic. That's really inspiring and appreciable. This is the first reason, Pragadheesh. Second,
during ADRPLEXUS times, in the class times, the leaderboard was very competitive and it was actually very tough to compete among about 400 students. I think anyone with a competitive mind can definitely push through their limits, sir, because there's a lot of competition there. That was very helpful, and obviously it would push you through and make you work as hard as possible, because it requires a lot of hard work. And third of all, the consistency, sir.
So the leaderboards, when you mentioned about the leaderboards, when you are competing with real time with the peers who are really working hard to get the ranks, and where you can assess like where exactly you stand every single day, is one thing which pushes us like every day to come back and perform stronger and better.
Yes, sir.
And secondly, when you mentioned about consistency, which is the most important thing for anybody's success. So what is your consistent schedule, or like how do you maintain the consistency, and can you explain in brief your preparation for the last 6 months?
Sir, I started proper preparation after my college convocation was on June 6th, sir, and my first ADR class was on June 10th, sir. So I started from my college on before day, sir, June 9th, and very next morning I started my preparation, because very next morning I had the class, and very next morning I was into the preparation zone, sir, because there was leaderboard on the very second day. So obviously I'm in the zone.
So it is 150 days exactly, June 10th to November 10th.
Yes, sir.
150 days it took for you to get All India rank 61.
Yes, sir.
By having the consistent schedule.
Yes, sir. And after my schedule was not so static, sir. It was dynamic. I was never able to complete everything on time. I would try to complete as much as possible. There was always something remaining pending for me to complete, but I would change my schedule accordingly. I would not give up, but I would try to change accordingly. It would have been changed at least 8 times, sir. It was many number of times, but somehow I tried to manage.
Fantastic. So on an average, how many hours you use to read every day on the days when there is no class?
Sir, I would try to read almost all the time, sir. I do not count the hours, sir, because but I used to take breaks occasionally. I would watch, go through my phone. I First 3 months I used to go to about one movie per month. That's all. And afterwards it was purely I was in the home only. I didn't
Okay.
go.
So it's not just the fixed hours, but the targets which you kept, like you try to achieve, you try to complete them basically.
Yes, sir. Yes, sir. I would. Yes, I only after completing the target I would go to sleep.
That's a very unique way of approaching the things, not counting the time and like getting the things done
It
like
would
what
be minimal, sir. I do not know. It may be 8 hours. Proper, maybe 8 hours. I do not know. I'm not sure.
Yeah, that's fine. It's most important thing is the target, like completing the target, like what you have assigned for that. And Pragadish, like on an average, how many MCQs you attempt every day?
It was variable, sir. I would try to do. I started from 50 MCQs per day. Try to do 150 to 200, sometimes 100 only. And last 1 month, I didn't try to do much MCQs. Last 14 days. I didn't want to get depressed on some questions, some difficult questions. Anyway, I have learned all the MCQs, so I didn't want to go through many. I did about 50 MCQs per day in the last 2 weeks.
Okay. So there's on an average, if you see like few days 50, few days 100, 150, like on average, you are touching 100 MCQs every day.
Yes, sir. 150.
100 to 150 MCQs. That's a very good number. And that is one of the most important factors, in fact, which contributed to your success, because doing more and more MCQs helps you to apply the knowledge which you learn and rectifying the mistakes from that.
Yes, sir.
And from the mistakes you made, how you made notes and how you consolidated them.
I write them. I highlight in a different way, sir. I use different color codings, sir. Like yellow, orange, green, and some things which I would forget anyway. I would mark it in green. Some things which are important, but I may not forget. I will mark it in orange, like that, sir. And I would write the extra points, if at all, PYQ points, PY topic points, extra points in the side, sir.
So it is like you prepared a separate book, like learning from mistakes notebook, or like you used
No,
it to
sir.
print out your
I
workbook itself.
marked in the same notes itself.
Notes itself. Okay. So how did you feel about ADRPLEXUS workbooks and how useful they are in your preparation?
It was very useful in my preparation, sir. Notes were good, sir.
Okay. And when you mentioned about the leaderboards, you attempted like every single day leaderboards turning up and workbooks. What are the other factors in ADRPLEXUS which helped you for your success?
Leaderboards were the competitive field, sir. Once we get into the class, every one will see how much competition is there around us and how much we know there is only limited seats. Uh, uh, we get an idea about how to prepare and where we stand among the competition, and it would be very helpful, sir.
Okay. And Pragadish, one more thing. From your journey of this 5 months,
Yes, sir.
being consistent, you mentioned, and how many times you revised?
Sir, I didn't revise every subject at a particular number of times, sir. For example, I studied anatomy about 4 times, but I studied medicine only like properly one time, and I rushed through the last minute, sir. That's all. And difficult subjects I revised multiple times. Some difficult subjects I was not able to revise multiple times. Gynec, OG, and PSM was difficult. Still, I was able to revise only 3 times, but anatomy I revised 4 times. Like this, sir.
Fantastic. 4 times is huge. And in the examinations, once you went for INICET examination, sitting in the examination hall and coming out, so how did you feel after completing the examination?
I was very confident in getting the ranks.
That you are getting like a very nice rank. That's the spirit. Like usually, like once you give the best attempt, you'll come out of the examination hall confidently. That's as simple as it. And Pragadish, for your colleagues and the juniors who will watch this video in the future, what is your piece of advice?
Sir, they should try to study well in the UG itself, sir, because it would have not been possible if I had not studied properly in UG, sir. Like there was a base over which I was able to do more MCQs now. There are very few hard topics for me, so it was easy for me.
Okay. From now on, like how they can improve the scores?
They should do the previous year topics very often. Previous year questions, even though they get it right, they should not feel overconfident that they will do well. They should try to get all the PYQs correct as much as possible. Even if you get 49 out of 50 PYQs correct, it doesn't mean you will get 49 into 4 in the real exam. So you should not feel overconfident with it. You should not even underestimate it. It is definitely required. Just because you get everything correct, you should not leave it also. Like
so it's a very different and unique perspective that it's not just about that, not just getting 49 or 50, but ensuring that you get all the things correct, and also the options related to that and topics surrounding that is also very important, because you won't get the exact question, but there will be topic similarities, similar topics will get repeated.
Even the same difficult questions are almost same questions are repeated with the same like the same answer. It will be difficult if you don't know the topic. If you have not faced the MCQ before, probably you will get it wrong, because only if you have seen that MCQ before, you will do it right. There are certain topics like it.
Okay, fantastic, Pragadheesh. So what is when you call your parents, like what is their first reaction?
They are happy, sir. Happy with
They're happy. And once again, hearty congratulations to your parents, family members, and all the teachers, Pragadheesh. And one last question, like which specialty you wanna opt and where do you wanna opt?
I would like to take medicine, PG Chandigarh.
PG Chandigarh?
Medicine, sir.
All the very best. And so Dr. Sanjay Jain is the head of the department and is a very good teacher in PGI, and PGI General Medicine Department teaches you a lot, and wish you all the very best, Pragadheesh. See you in next 3.5 years in the convocation in PGI Chandigarh.
Thank you, sir.
Okay. Once again, hearty congratulations and all the very best, Pragadheesh.
Thank you, sir.